Hey, what's up, podcast? This is Dr. Ryan Ballman, sports physical therapist with Endeavor Health. Thank you again for listening to the Endeavor Health podcast. This is a little bit of a throwback. This was one of the first interviewees I've had for pretty much my practice when I was making videos a few years ago. This is an awesome talk. I've released this video before on a more shortened version, but obviously I've gotten way more savvier in terms of uploading longer files and bigger video files. So I hope you guys enjoyed. This is a talk with Jacob Lonowski. At the time, he was the strength and conditioning coach for Georgia State University, and we've kept in touch. He's an awesome guy, very, very knowledgeable in terms of strength and conditioning, and I am proud to say that one day he will be one of my colleagues in the physical therapy profession. He is currently a physical therapist student at the Georgia State program, and so shout outs to Jacob. I hope you're doing well, and I know you're going to kill it out there in PT school. So I hope you enjoyed this talk. It is great. It's jammed packed, and this is what happens when you get two strength nerds together, because we could easily talk for about 30 minutes to an hour to more. Keep a note that a little bit, pretty much at the 25th minute mark, it'll just stop, and then we just catch on currently on the conversation. This was when I was still learning how to do long form video and audio, and learned that my camera at the time only records up to about 20-25 minutes, and then it stopped. So if you're probably wondering why the conversation just abruptly stops and then just keeps going, that is why. So without further ado, enjoy this throwback podcast. Thank you for listening.
What's going on, everyone? I'm Dr. Ryan Baums here with Endeavor Sports Physical Therapy, and I have a special guest with me, and I will let him introduce himself.
Hello, audience. My name is Jacob Lonowski, and I'm a strength and conditioning coach over at Georgia State right now, and we are here to discuss random topics and ramble a little bit.
Yeah, we're going to ramble, and I'm going to really pick his brain only because I think as a sports physical therapist, there's a lot to learn from someone like him from a strength and conditioning side. I'm aware of some of the principles that they use, but what they do every day, day in, day out, is stuff that I do my best to apply, but I know once a patient or client's ready for it, these are the guys to come up with. So we met at a weightlifting event.
Yeah, it was a USAPL event called Lift for Life that one of my friends, Ty Carzoli, put on. It was a great event.
Yes, shout out to Ty. Great event.
They did an excellent job putting that thing together. But we just started talking, and I'm always up for learning more about how other fields handle human development. And we are here to discuss some of those topics.
And I felt very small in that event, only because I'm a runner and I'm on the complete opposite spectrum. And these guys, what was your lift for deadlift?
I
That was
squatted 6, I benched 407, and I deadlifted 617.
You made it look easy. From my standpoint.
It felt heavy. Heavier than it looked, I promise.
You went, boop, and you're done. And you're out of there.
But
it was awesome.
It is a work in progress with all of it, always.
Yeah. So it was for me as a physical therapist, I thought it was a great just appreciation of movement. I think there was a young woman there that lifted 3 times her body weight.
There's a 3 times body weight deadlift. I think she was she couldn't have been much more than 100 pounds.
Yeah, it was amazing. So
she was incredible.
If you're watching, congrats to you, because
nice work.
Nice
Big lift.
work. Yeah,
big lift, incredible.
Big lift. So, so tell me, so what is it you do at Georgia State? What is it?
Well, right now I am the head of Olympics, of Olympic sports, and I work with baseball, softball, track and field. And I've been working with track and field for, 2 years now, and baseball and softball for 1 year. We had some staff transitions about a year ago this time, so we shuffled up the teams, and those are the ones that I'm helping improve.
Nice.
Yeah.
Nice. And so do you find with each sport, do you strengthen for certain things specifically, or do you think all sports should have a base strength and movement?
Both.
Both?
So to get into just talking about programming for sport specificity, it is important, but it's also not everything.
Yeah.
If there isn't a general foundation of development and force production, then the specificity doesn't matter.
True.
Well, for
True, makes
example,
sense.
with a pitcher, if they don't have the means by which to produce more force through the ground, then it doesn't matter how stable their shoulder is. And this is a conversation I have to have almost every day with the pitchers about being able to relate force production with stability, because a joint can only be as stable as there is force produced.
Yeah, yeah.
So just convincing them that getting stronger is actually going to help their shoulder.
Yeah. So why do you have to convince them? Is there like a misconception if they get too strong, they get either too big, or they're not going to play as well?
Yeah.
What are some of the barriers you see? Because I get that a lot, like especially runners. I tell runners, you guys need to strength train a lot, only because you need, just like you're talking about, force production will lead to just better outcomes with your run. So what are some of the misconceptions or objections you hear?
It's a huge issue when you're trying to interact with different sports, because each sport kind of has their own culture.
Yeah.
And each sport kind of has their conventional wisdoms that they hold on to. Like, distance runners or endurance athletes shouldn't lift weights because somehow it's going to weigh them down to like they can't be competitive.
Or suddenly they feel like they'll grow muscles when
they
they fail to realize it's very hard. It's very hard to gain muscle. It doesn't happen like that.
They squat a couple times and
then suddenly they're
14 pounds a week. It's like, no, that's not
I wish.
Happens.
I think a lot of people wish that happened.
Well, with overhead sports, there's just pervasive ideas that they should train overhead when that's the very position they need to be strongest in. They need to be the most stable in that most compromised position.
Makes sense,
So when you're talking about how you train that can be debated, but that you should train it cannot. You need to be able to control your positions overhead, whether it's tennis, volleyball, baseball, softball, any overhead sport or any implement rotational sport. You need to be able to stabilize those joints. Otherwise, they will be compromised.
Compromised over time.
And a common pitching mechanic for baseball is if the shoulder can't stabilize the energies involved in the movement, then the elbow will drop to find a place of greater stability. But when that elbow drops, you're not stabilizing with bigger musculature. You end up stabilizing more at the joint with non-contractile tissues, which then leads to probably the most common injury in baseball right now, which is UCL rupture, UCL damage.
Yeah. And you bring up a good point. So I know for some confusion sometimes with sports physical therapists, some of the techniques or drills that I do here, they'll confuse, am I a coach or am I a physical therapist? And I'm by no means a pitching coach. I know how the body moves, but when it comes to analyzing mechanics for a baseball player to make them successful, that's not really my deal. Do you feel like that's the same with you in terms of how you work with your athletes versus coaching and then where you come in?
I think in all areas of human performance, you have to have an eye for biomechanics.
Sure.
If you don't understand human movement, you're going to only be able to add so much value to the people you work with. So I think there is a limit to it where, let's say, a pitching coach will be able to analyze more specifics, but still general movement is movement. Whether it's a sprinter, a hurdler, or a thrower, understanding more efficient positions is going to translate over into improved performance.
So you feel like, and correct me if I'm wrong, like you help them prepare to be able to be successful with their hitting coach or pitching coach or things like that.
Giving them the physical tools or helping them develop the physical tools.
Yeah, exactly. And I feel like that's where I feel like I come into is I prepare the physical tools, but I also rehab it, get to those physical tools, and then again, that's where we could, work together in terms of prepping that athlete for that sport.
Yeah, where I think that to kind of define the roles that we serve, because like we were talking about earlier, it's more or less the same thing, but it's in different phases of performance level. So if something is more compromised or there is a serious dysfunction, then it's going to be more towards your side. But once there are healthy enough relationships, then it shifts towards me.
Agreed. Yeah. And I think that's important because I know I may have met some colleagues that feel like they could do it all, but I
Mhm.
would rather have them rely on strengths of guys like you
Yeah.
because then we'll have more time to deal with those that are hurt.
Yeah, and
You know?
it's not that a physical therapist couldn't perform general
Yeah.
strength,
Yeah.
like administer general strength training, but at the same time, you have 24 hours in the day, and you're specialized.
Mhm.
So I think that the most value you can offer the
Agreed.
athletes
Yeah.
is with your specialty, and same here.
Mhm.
If I spend enough time developing myself, then maybe I could start offering more physical therapy like modalities. But at the same time, right now that's not my specialty. I can't. I think it's more efficient if the different human performance professionals perform in their specialization.
Yeah. So, changing it up, what's your favorite strength exercise or strengthening exercise for your athletes?
If you have to choose one, squat.
Squat. Why?
Because it gives you the most for the least.
Totally agree.
It stimulates the most musculature, and it's the most functional pattern that there is.
Yeah. I find myself, when even working with like older clients, it's literally sit in the chair and then stand up, and we repeat.
And that's how that is a squat.
That is a squat.
And if
in
that's
its
where
basic
they're at,
form,
if that's where they're at, then do it.
Yeah.
But you certainly can progress the squat all the way up until you have 1,000 pounds on your back.
Exactly.
And try not to get crushed.
Yeah. Yeah. So then, I bet that when you're teaching your new students squatting, there's all these variations that you have to reteach and help them.
Because when you are doing any of the major movements, you're incorporating in essentially every joint in the body. And if there's dysfunction at any one of those joints, then it will be exposed in any kind of squat. And if you're just doing an evaluation where you've got a PVC pipe, you do an overhead squat, and they're all over the place, there's a lot of work to be done.
Yeah.
But with each sport kind of has archetypal problems.
Yeah.
Where you move towards basketball, you've got a lot of really stiff ankles that have been immobilized in poor shoes.
From past injuries, things like that.
They spend 10 months out of the year jumping on hard surfaces with ankle braces on and high ankled shoes.
Mm-hmm.
And then we wonder why they have knee and hip pain.
And they wonder why they can't get deeper into
squat. Why they can't squat.
Yeah.
It's because their ankles have been casted for their
Once.
entire youth.
Yeah.
So that's much more of a common basketball issue. And sliding towards baseball, you get a lot of kyphosis, a lot of abducted scapula, and internally rotated humerus. You see pitchers walking around like this, but they can throw 95, 96. It's like something's going to give.
Yeah. Tissue adaptations from the sport. Yeah.
But that kind of plays back into if they were able to stabilize and move at a high quality overhead, they would have never gotten there.
Mm-hmm.
But I could rant about that all day. And even into positions with football, you see archetypal issues.
Mm-hmm.
Where I played offensive lineman in college. Problems with offensive linemen. They can't, when they move, they hip flex. They don't hip flex very high, so you see them sprint, and it's like they're able to produce all this power, but then their knee comes halfway up.
It's a lot of force in a short amount of time. It's the pure definition of power.
So there's all of this movement that is not being taken advantage of or trained.
True.
But those are you could go to every sport and every position in those sports and find those archetypal issues that then will start to lead to the archetypal injuries. Like ACL in soccer, because they're toe loaded all the time, underdeveloped.
Always got to make it the cuts. Always got to get ready for the ball, react to the ball.
And got kind of off tangent there.
Yeah.
But now what do you do with all those archetypal issues is then you can address them with archetypal corrective exercises or different training protocols. So if you're working with basketball, before you did a squat session, you can open up the ankle pre-squat movement. That's one example.
Could you explain really quickly, and I know I've talked about this with some of my clients or even on my blogs, about managing load? Because I know there's been some recent papers out where if you manage your training load, you could actually almost prevent injury.
Yeah.
And it almost makes sense. We see it day to day where if you doubled your training load over the course of a week
Whoa.
or 2 days,
Yeah.
you're going to get hurt.
You have a bad time.
Could you explain, like, real quickly, like, in terms of managing load and even from a strength conditioning, like cycling and doing things like that? Yeah.
Okay.
Yeah.
Semester course.
Yeah, no.
um,
But some of the things that you look out for in terms of load, and how do you
So-
know you're progressing?
to simplify it,
Yeah,
just periodizing well and having a plan that maximizes progress while minimizes risk is the art of programming.
agreed. Yeah,
Because you're not going to make any progress without risk. You can't.
Yeah.
You can't.
yeah.
But
And I
it
wrote
is-
a blog post about that where the moment you're involved in a sport,
Yeah.
you're putting yourself at risk. If you don't want to put yourself at risk of injury and prevent it completely, you just sit on your couch,
Don't.
sit on the couch,
Acute risk.
Yeah,
And then
yeah.
chronic risk. And then
you get the chronic
yeah,
risk.
you
Yeah,
get
but
the
if you
chronic
don't want sports injuries, just sit
Don't
on your
do
butt.
anything.
Yeah,
Yeah,
don't
don't
do
do
anything. Yeah,
Bubble wrap, Iron Man suit.
yeah.
You're in no
You're
damage.
good. Yeah.
But where if you're accepting unnecessary risk in your programming, that's where I have a problem.
Mhm.
And seeing different styles of programming, they have unnecessary risk incorporated into them without the return. And I think that's unacceptable as a strength professional to see athletes being prescribed certain protocols that are more dangerous than they're worth.
Yeah. And I know for me, I've seen a lot of running clients lately, is I really like to dig in as to, like, what have your trainings been like? And sometimes I immediately, once I hear errors, that's likely the cause of injuries. Oh, I doubled, my long runs over the course of a couple weeks. Or, oh, I didn't do anything, and then I suddenly jumped up to a 20-mile run, and
Yeah.
I've never done it before.
Okay.
So it's those loading errors or training errors that it could really hurt athletes, for sure.
With the total volume, if we just talk about training volume over the course of a period of time, the human body is capable of almost anything
It's true. Yeah.
with a proper plan, with a smart approach. And when you're talking about reaching elite levels, you're talking about 10, 15, 20 years to get to that volume
Yeah.
at those intensities. Where novices taking an elite level protocol and trying to execute it, it's a recipe for disaster, especially if they're not moving well.
Yeah.
But periodizing in such a way where over time you just kind of undulate through it, where volume and intensity just kind of wave in and out.
Yeah.
And over the course of a 4 or 5 year collegiate career, you can get a lot done.
Yeah.
If you just trust.
But you have to plan.
Yeah.
You got to stick with it. Even if injuries occur, you got to manage the injuries and manage and change the load up
Oh yeah.
for them to continue. You don't want to shut down completely because then you'll lose everything.
Yeah, and where athletes want to get as good as they can, as quickly as they can.
Yeah. Fair. Yeah.
But if you can convince and communicate with the athletes in such a way that gets them to trust the process and slow down in their development, then they'll see huge returns on the back end.
Mm-hmm. Yeah.
But it's where they rush into things and their training load, their training intensity is too much too quickly that then they compromise the very thing that they think that they want.
Yeah. And I see that too, where injuries happen where they go gung-ho into something new.
Mm-hmm.
Understandable, they're excited.
Yeah, fun.
And then they get hurt. And then that injury itself could hold them back and make them realize, maybe I don't want to do it anymore. And then they lose years and maybe decades of potential, like a healthy lifestyle.
Or over the course of an athlete's career, the number one limiting factor is going to be injury. Because if they're injured, they're not developing.
Mm-hmm. Exactly. Yeah,
And
they're not doing the time. They're not putting in the time.
Yeah, they just enter
For their
into
sport.
a deficit. Let's say there are two athletes that are equal. One gets hurt, and then the other person is still improving.
Yeah.
So that gap, it doubles up. It's a
Yeah.
compounding effect.
Yeah.
And then if you don't completely recover from that past injury, and then it flares up again, then you're back into a hole.
Mm-hmm.
And then the people that you were on par with before injury are now light years beyond you.
Yeah.
You can't catch up.
And that's why when I work with athletes, I'm really aggressive in terms of getting them back, matching appropriate exercise, but have that intensity that almost feels like a competitiveness that they would have done even before pre-injury.
Yeah. And that's
important for the athlete too.
I've seen in some different physical therapy settings that they don't challenge
They're not
the
challenging
clients. They
enough.
don't challenge the clients.
It's almost as if they're babying them too much. You're scared that they're going to get hurt more. But that alone, mentally, that could be dangerous too as well. To make them think that, they're a fragile little doll and then imagine when they get back into the field, they were never really prepped even mentally and tested physically to get ready.
I think that's a very good point, because once you enter into competition, when you're full speed, if you hesitate, you're hurt.
Yeah.
And if you're talking about contact sports, you hesitate, you're hurt.
Yeah. Or in soccer, you hesitate, that's a lost touch on the ball.
Yeah. You're beat.
That's
a step.
Instant goal. Yeah,
it's a step. You got out of position. You got out positioned. You lose.
Mm-hmm.
So when athletes are recovering from injury, a huge point. You have to challenge them, of course, in an intelligent way.
Yeah.
But if
not brute force.
Oh, of course.
Yeah, you're going to kill it.
1 week post-surgery? No. But as the rehab and the development progresses, if you don't instill a confidence in that once compromised joint or structure, that's just going to be looming in the back of the mind constantly.
Yeah.
And until you know it's good to go and it's been battle tested, you're not going to commit 100% to any kind of activity.
Yeah.
And that can hold you back. That's another factor that can hold you back from improving at your optimal performance.
Yeah. And especially the way I like to look at it too, I work with clients that have personal trainers, things like that they want to get back to. I want them to feel confident, because if they get back into it and they're still not confident, it's going to hold them back with training with you or training with another sport.
And if they're favoring, let's say the ACL,
compensation,
they start favoring because they're still afraid.
Or they're not even aware that they're favoring.
Yeah. So when they come post-rehab, and if they don't have confidence right after rehab when they're released, then that's just going to be another series of progressions to get them back into evenly loading their body.
Yeah.
And to have a balanced force production.
And then they have to retrain everything, even vestibular spinal.
Yes.
In terms of eye tracking, control, balance.
What you'll see is that, you look at the localized tests, say, okay, well, the hip flexion is now even to that hip flexion, that knee extension, now it's within 90% of that knee extension.
Yeah.
But how does it all work together?
The specificity of the domain of the sport.
Yeah. So yes, those local movement patterns are now ready to go. But now how does it look when we start getting dynamic? How does it look now when we start bringing in the whole body, a global view on the reintegration of that joint to movement? Because more than likely, if we just stick on ACL, it's going to have been immobilized for a period of time. There's going to be restricted movement for a period of time. Just because the musculature is able to produce relative force at the other limb does not mean the movement patterns, the quality
specific
of
to it.
Even if we just think about just the squat, the favoring that's going to occur on that leg is going to be huge. So the forces are 90%, but
the training of using that 90% is a little
poor. Yeah.
So changing things up though. So what about, we're talking about collegiate athletes, like high level athletes, but what about like the average weekend warriors?
Okay.
Those that work the 9 to 5, but they still want to be active.
Yeah.
Or they've never been active before, but they know they need to. What's probably your number one tip from a strength and conditioning standpoint for them to get started or continue as a weekend warrior type athlete?
If you're employed at a location where you're doing a lot of sitting, if you're not at least trying to undo what you've done all day, it's going to be tough to make any progress in it from a developmental standpoint.
Makes sense.
Because if your hip flexors are on lockdown, your glutes have been asleep for 10 years, and you want to go right into lifting heavy, it's only going to be a matter of time before there are serious consequences.
Yeah. This makes sense when I first met you, and I joked around, or not joked around, but I asked, what's the number one injury? Is it low back or things like that? And you guys like laughed, because that doesn't happen for you guys. And then it made me realize, I've been preaching to all my clients, you need a weight lift, and you guys weight lift all the time.
Yeah.
So of course you wouldn't have low back pain.
And certainly there are times where things flare
Oh,
up,
true.
of course.
But for the most part, because you are lifting such heavy loads, your core has to be strong, glutes are strong, the likelihood of a low back pain injury versus someone that's sitting on their butt all day.
Yeah, they sit, their hip flexors are pulling on their lumbar, like their psoas just yanking on their lumbar.
Going to lumbar extension.
They're trying to fight against that with lumbar extension, even though they're sitting in lumbar flexion all day.
Yeah.
It's a mess.
Yeah.
And they want to start, people like that, if they're weekend warriors, if they jump right into deadlifting without proper bracing, proper mechanics, proper position, it's a time bomb.
Yeah.
Time bomb.
Yeah. Then I see it.
Yeah.
And then I got to start all the way from the beginning and talk, wait a minute.
It's like I started lifting to try to help myself,
Which
and I
is
don't know
cool.
why I got hurt.
Yeah.
So improving your positions, improving your mechanics first.
Having a plan.
Having a plan, starting lighter and working on movement quality first.
First is load intensity.
Yeah.
Don't try and impress anyone at the gym.
Because you won't.
You won't impress anyone if you're hurt, so that's not going to matter.
Yeah. Weeping with a bracer on your spine is not typically the most masculine position.
No, definitely not. Definitely not.
Yeah, where in the long term, again, if you can just engage in the process of developing your body and your positions, the strength will come. And the strength is going to be what keeps you healthiest the longest. Because when you look at... We're rolling?
We're rolling?
We're
kind of rolling now.
Yeah? Sync it back up?
Yeah. I'm going to put this all in here.
Yeah.
I'm not going to edit it.
Okay.
Just keep it as raw as possible.
Embarrassing.
I'm just going to put it in there. It's totally fine. As a first video. As a first interviewee, this has been fun. Yeah. No pressure. Yeah.
I hope it set a terrible precedent.
He only interviews guys that are bigger than him.
But with the runners, the common distance athletes, you see those really underdeveloped. Just the lateral part of their hips.
And they have IT band tightness to make up for the fact they don't have that strength.
They're trying to find stability somewhere.
Stability in that mile 15, 16 of their marathon.
So once their weak glutes just are so fatigued they can't produce force, it's going to be found somewhere.
It's going to hurt.
And this is something I try to communicate to my interns that we have, is that adaptation isn't always beneficial. It's adaptation. And depending on what the stimulus is, dictates what the adaptation is.
Yeah.
So if you have poor stimuli, then you're going to lead to poor adaptations. So it's up to you as the professional to ensure that the stimuli lead to beneficial adaptations.
Yeah. You're not just exercising for the sake of exercise.
Yeah.
It's always specific. It's more quality over quantity. And we were talking about that earlier in terms of typical PT clinics will have you go through a run of all these exercises for 55 or 60 minutes, but then all for what? Was it really specific? You know,
I did the exercises.
Yeah, I did the exercises. I'm better. No, you're not better.
Yeah.
If I had one exercise, I would just do one exercise for 30 minutes.
Yeah.
That'd be fine. That would be complete. That would be a happy session for me and my client.
Yeah, we're talking about the way developed powerlifters train. They're not doing a whole lot of variation. Especially when they're getting closer to meet date, because they're training more specifically, and it's squat bench deadlift day. What are you doing? What are you doing today? Squat bench deadlift. That's what I'm doing.
That is it.
Three things all day. Where shin splints are an adaptation to a stress.
Yeah.
To the stimuli.
And that's something I have to try and figure out and assess and where is this happening? Why?
Osteophytes.
Yeah, but oftentimes too, if I just ask in their subjective history, I could already have an idea as to why. Whether it be training load, poor planning, things like that. So that probably was it.
And I think that's another big point to take home is just because you're moving doesn't mean you're making progress.
It's better than nothing.
It's certainly
but
better than zero.
If you want to, if you want to get better and progress.
But there are things even better than zero. Like
Yeah.
Well, yeah, you could have been here.
Can we be here than here?
Yeah. Just like common issues, like just okay, I'm bench pressing and curling every day.
Yeah.
Also, you're adapting, not in a way that's beneficial.
Yeah.
So cool. What's next?
What is next? Well, let's see. Let's finish off with one final question. So,
Okay.
What are your thoughts in terms of just the importance of strength in general for the athlete, weekend warrior, things like that? Like, why is strength so important?
So, strength is critical to being a human.
Yeah.
And if you want to stay healthy, even if you don't care about sport performance,
Yes.
if you want to stay healthy and active for as long as you can, before death comes for you, because it's coming, you need to be able to produce as much force as possible to stay as stable as possible. And of course, movement quality and mobility is important, but they're not separate. If you're able to produce more force, you're going to be able to stay more stable through greater ranges of motion.
Yeah.
So strength is movement. And with weekend warriors, average Jane and Joes out there, if they're stronger, their kids are lighter. If they're stronger, those grocery bags carry them 15 at a time.
Yes.
A gallon of milk isn't a max effort overhead press.
Yes. Yeah.
So if you just think about it, strength is functional.
Yeah. And I like to look at it as gravity will always win. The moment we were born here on this earth, gravity is immediately our number one enemy.
And from a performance and athletics side of things, being able to produce more force in reduced periods of time means you're moving faster.
Yep.
It means you're accelerating at greater rates and
you're
reaching
your
greater
competition.
velocities. Yeah. So if you're able to be able to move faster, you first must be able to produce more force. And if that improved force production is paired with improved movement efficiencies, then you're literally making leaps and bounds.
You are beating the competition.
You're running faster than your opponent, and you've won.
Yes.
So with improved position, improved movement quality, with improved magnitude and rate of force production, that makes you a better athlete. If you're able to absorb, stop, and reproduce your movement in shorter periods of time, all of a sudden you just outposition someone, and you win.
And you win.
And you win.
And we're here to win.
Well,
winning's not everything, but winning is everything.
Winning isn't everything. But
it'd be nice.
But winning is certainly better than not winning. Winning is a lot better than any other alternative.
Yeah. Well, Jacob, thank you for being on. I guess is it a show? The video?
Sure.
Show video. The first interview.
We've had a great shot of Muhammad Ali knocking some poor soul out.
Yeah.
Sorry.
Yeah. So thank you again for having me. I hope thank you for coming over.
Yeah.
I hope this goes to show, as a sports physical therapist, it's not just us. We really love to collaborate with like minds. And again, when I first met him, he was definitely a guy that I'd love to pick brains with and hopefully learn more as we continue. So again, I'm Dr. Ryan Balms with Endeavor Sports Physical Therapy.
Jacob Lonowski, Georgia State.
See you guys.